When you have angina pectoris, that severe pain, oftentimes it's a good sign that you are having a heart attack. A myocardial infarction is a heart attack. And what's happening is you're not getting blood to the heart muscle. So one of the coronary arteries is being blocked. This can lead to tissue death, and that's what you're seeing right here, tissue death, and it's usually associated with severe pain in the chest, running down the left arm, sometimes up into the neck and into the jaw. Females have different signs than males do, so we have to look for different things, and we'll do a little, we'll do a case study on male versus female problems with heart attacks. So you'll get a little bit more understanding of how females respond to the same types of stimuli. The next thing we're going to talk about then is the conduction system of the heart. The conduction system, so we all know that for muscles to move, nervous stimuli have to occur. The nervous system stimulates our muscle fibers and then we can move our body. But the heart doesn't work that way. Now there is nervous innervation, but the heart can beat without the brain's information. You can be brain dead and your heart can still beat. This is one of the reasons there's problems with people arguing when is death. When does death occur? When the heart stops beating or when the brain stops functioning? And I would say the majority of individuals, including myself, when your brain stops functioning, that is death. The heart can beat. You can take a heart out of someone's body and keep it beating forever if it has the proper solution surrounding it. So the heart has its own pacemaker, and we all know what a pacemaker is, I hope. Typically, when you think of a pacemaker, you think of someone who's had a heart attack or who's had some cardiac problems. And so they have a physical pacemaker placed into the heart that stimulates the heart to beat every few, not every few seconds, that sounds horrible, about one every 0.8 seconds. But we have this in our heart already. In the right atrium, we have this little node called a sinoatrial node. This is our pacemaker, and this sends signals to this AV node, which is also in the right atrium. The AV node then sends signals down through this AV bundle to these two bundle branches, and the bundle branches then lead out to these Purkinje fibers, which are found in the ventricles. They run out into all the regions of the ventricles. And so you have the stimulus, SA node, AV bundle, bundle branches, and then Purkinje fibers. And as the stimulus occurs, it causes the contraction to occur. The AV bundle then is in the right atrium. I already mentioned this. And then you have the bundle branches, which also is known as the bundle of His. If you've ever heard of it that way, that's fine. It divides into a left and right bundle that run down into both left and right ventricles. The Purkinje fibers run out throughout the ventricles to cause a nice strong contraction in the ventricles. Oh, no. Oh, this is okay. This is a video that talks about ECGs and the cardiac conduction system. So I'm going to have you watch this. It's a 3-minute video.
Conduction system consists of the following components. The sinoatrial node, or SA node, located in the right atrium near the entrance of the superior vena cava. This is the natural pacemaker of the heart. It initiates all heartbeat and determines heart rate. Electrical impulses from the SA node spread throughout both atria and stimulate them to contract. The atrioventricular node, or AV node, located on the other side of the right atrium near the AV valve. The AV node serves as electrical gateway to the ventricles. It delays the passage of electrical impulses to the ventricles. This delay is to ensure that the atria have ejected all the blood into the ventricles before the ventricles contract. The AV node receives signals from the SA node and passes them onto the atrioventricular bundle, AV bundle, or bundle of His. This bundle is then divided into right and left bundle branches, which conduct the impulses toward the apex of the heart. The signals are then passed onto Purkinje fibers, turning upward and spreading throughout the ventricular myocardium. Electrical activities of the heart can be recorded in the form of electrocardiogram, ECG, or EKG. An ECG is a composite recording of all the action potentials produced by the nodes and the cells of the myocardium. Each wave or segment of the ECG corresponds to a certain event of the cardiac electrical cycle. When the atria are full of blood, the SA node fires. Electrical signals spread throughout the atria and cause them to depolarize. This is represented by the P wave on the ECG. Atrial contraction, or atrial systole, starts about 100 milliseconds after the P wave begins. The PQ segment represents the time the signals travel from the SA node to the AV node. The QRS complex marks the firing of the AV node and represents ventricular depolarization. Q wave corresponds to depolarization of the interventricular septum. R wave is produced by depolarization of the main mass of the ventricles. S wave represents the last phase of ventricular depolarization at the base of the heart. Atrial repolarization also occurs during this time, but the signal is obscured by the large QRS complex. The ST segment reflects the plateau in the myocardial action potential. This is when the ventricles contract and pump blood. The T wave represents ventricular repolarization immediately before ventricular relaxation, or ventricular diastole. The cycle repeats itself with every heartbeat.
Oh, no, jeez. I don't know why this always happens. Boom. And then I want that. Okay. So the heart doesn't need the brain to function, but the brain does innervate the heart. It stimulates the heart to beat faster when we enter our sympathetic system, so the stress or fight or flight mode, and it naturally or normally innervates the heart to slow the heart down to what we call our typical heart rhythm. So in the brain, we have a region called the cardiac center. It's in the medulla oblongata. And it has a cardio-acceleratory and cardio-inhibitory region to it. The inhibitory region, which runs from the medulla all the way to the heart through the vagus nerve, stimulates the heart to slow down. The sympathetic system is going to be run from the cardio-acceleratory region, and it not only speeds the heart rate up, but it also causes blood vessels to start to constrict in certain areas and dilate in other areas. So parasympathetic innervation slows the heart rate down. This is controlled by the vagus nerve, and it decreases our heart to the natural rhythm, to its inherent or to its normal rhythm that we know. Cardio-acceleratory region is going to increase the heart rate. It increases dilation of many of our blood vessels and decreases or constricts other blood vessels. Stimulates other blood vessels to constrict so that blood flows to the areas of our body that will allow us to survive whatever stressful situation we're in, be it exercise, an exam, driving, or sitting in a car with our 15-year-old who is learning how to drive, stuff like that. So our heart rate then can be determined by the number of beats that occur every minute. So our inherent rhythm, what our heart would beat at without any nervous stimulation, is about 100 beats per minute. But that's really, really fast. And so our vagus nerve actually slows the heart rate down to about between 70 and 80 beats a minute. So an average heart rate is about every 0.8 seconds the heart beats. Okay, anyways, so that's how often the heart is going to beat normally during relaxed times. So what happens when the SA node fails? We have other pacemakers. We have other cells that can act as pacemakers. These are called ectopic pacemakers. The first ectopic pacemaker that we have is the AV node. If our SA node fails, the AV node can take over, and it can actually start stimulating the heart to beat, but it's going to beat very slowly. The AV node stimulates heart rate of about between 40 and 50 beats per minute. If the AV node also fails, then we have other cells within the heart that can stimulate the heart to beat, but the heart rate would be very slow, about 20 or 30 beats per minute. In any case, be it the AV nodes or the other cells within the cardiac muscle taking over the pacemaker activity, you're going to have to go into the hospital, and you're going to have likely an artificial pacemaker placed into your heart so that your heart can beat normally, because the slower the heart rate, the less oxygen we're getting to our cells, unless we have a really strong heart that's pushing blood really fast. So, and that's not going to happen if our SA node isn't functioning. Last thing I'll mention before I turn this video off is some clinical views about the conduction system. So atrial flutter occurs when the atria start to contract out of sync with the ventricles. So they're kind of fluttering. The ventricles contract, 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 and the atria are kind of fluttering, fluttering, fluttering. Premature ventricular contractions occur typically from increasing certain chemical stimulants, but it can also occur from increased stress on the body. And what happens is the ventricles contract, and then they contract again out of sync. Ventricular fibrillation is a serious disorder where the ventricles are basically contracting out of whack. So they just keep fluttering, kind of like the atrial flutter, except for much faster. And when the ventricles do this, blood can't get to our system properly, and so it can lead to death. In that case, we tend to shock a patient so that their heart stops and can go back to its regular rhythm. I do have a video I'll show, but I'll show it on the next video. So I have a video here from YouTube that I will show you in our next video. Okay? Have a wonderful day, evening, or afternoon. Bye.